مرحبا، بهاي السلسلة راح نشرح كتاب بيتر بانك Fractures of the Facial Skeleton. الكتاب اللي يحتاجوه المتقدمين الامتحان البورد سواء العربي أو العراقي لجراحة الوجه والفكين. راح نشرح هسه الجابتر الأول. الجابتر الأول Facial Trauma Incidents, Etiology and Principle of Treatment. Facial trauma is a challenging area of clinical practice. By its very nature, the highly visible effects it can have on both the function and aesthetic of the face means that any repair that is less than perfect will be all too apparent. راح كلش تكون ظاهرة. Injuries to the nasoethmoid region are especially noticeable. The medial canthus needs only to drift a millimeter or so to become obvious. يعني حرفيا الكانثس لو مليمتر واحد حركت راح تبين obvious. However, fractures are just one component of the spectrum of maxillofacial surgery. احنا مو بس نعالج الفراكشر. They are variably associated with injuries to the overlying soft tissues and neighboring structure such as the eyes, lacrimal apparatus, nasal airways, paranasal sinus, tongue, and various sensory and motor nerves. The bones and tissue of the face support and maintain a number of key functions, including those relating to the oral cavity, nasal cavity, and orbits. يعني هسه شنو؟ number key function including those relating to oral cavity, nasal cavity. هاي من البونز مال الفيس, nasal cavity and orbits. يعني mouth والnose والorbits. Not surprisingly, injuries to the face can have a major cosmetic impact, obviously, and even so-called minor injuries, if poorly treated, can result in significant disability and an unsightly appearance. When fractures extend into the skull base and involve the intracranial contents, they are usually referred to as craniofacial injuries. يعني طلعنا من منطقة الفيس رحنا منطقة الجمجمة. These will often require combined management with a neurosurgeon. يعني بس الماكسيلوفاشيال سيرجن يقدر يشتغل, لازم وياه neurosurgeon يعني يشتغل على الجانب الكرانيال. Facial trauma can vary in severity, therefore, from a simple crack in a bone to a major disruption of the entire. من simple crack لو disruption of entire facial skeleton with associated severe soft tissue injury. Most facial injuries occur following relatively low energy impacts and require relatively straightforward treatment. High most. However, despite high patient satisfaction rates, less than perfect results are still common. يعني صحيح إنه البيشنت يكون يعني رغم رضا البيشنت بس إنه هو تكون less perfect. Clinician treating these injuries should strive for the ideal goal of returning the patient to their pre-injury form and function. لازم ترجعه مثل ما كان. Unfortunately, in many cases, especially when high energy injuries have resulting in both comminution of the facial skeleton and significant soft tissue damage, this cannot always be achieved. Despite major developments in the field of tissue healing, biomaterials and surgical technology, there is still room for improvement. يعني لساتنا نقدر نطول بعد. Although fractures of the facial skeleton are common, they can easily be overlooked when accompanied by soft tissue. يقول لك يعني رغم السكيلتون انكسر يتغاضون عنها بسبب soft tissue swelling or laceration. Delay in diagnosis can contribute to the likelihood of residual deformity, and all doctors working in emergency departments should therefore be able to recognize these injuries. يعني بس تجرح الوجه والفكين, understand their significance, and be familiar with basic management. Fractures of the lower jaw or alveolus may also present to a dental surgeon in general practice, or very rarely be a complication of a difficult tooth extraction. يقول لك fracture of lower jaw or alveolar may also present to a dental surgeon in general practice, or very rarely be a complication of difficult tooth extraction. An understanding of facial fracture as well as other facial injuries has a practical application for many specialists, therefore, and is not just of relevance to those studying for higher qualification or those pursuing a career specialty surgery. يقول له understanding بالfacial fracture as well as other facial injury has a practical application for many specialists, therefore, and is not just of relevance to those studying for high qualities or those pursuing career in specialist surgery. When considering the topics of facial fractures, parallels can be drawn with orthopedic surgery. يعني الماكسيلوفيشيال وهي طبيب التجميل orthopedic surgery in sense يعني كم أشياء ويانا parallel متوازية. In a sense, management of facial trauma can be regarded as facial orthopedics يعني تجميل وجه, and such requires the same core knowledge of fracture management and application of similar treatment principle. يعني احنا وياهم ندرس نفس الشغلات. These include an understanding of fracture healing, principle of fixation, and an application of the importance of the soft tissue envelope. However, facial surgeons will also need to draw on their specialist aesthetic skills to ensure that the best possible result, facilitating this by being as anatomically precise as possible. يقول لك however, the facial surgeon will also need يعني أنت كجراح ماكسيلو تحتاج to draw on their specialist aesthetic skills. يعني لازم مو بس طبية وجراحية, لازم تجميلية to ensure the best possible result. Incidence. When considering trauma in all its forms, maxillofacial injuries are not particularly common. يعني مو كل الشائع, although it is difficult to arrive at any accurate estimate of their global incidence. Estimates vary considerably both within and between countries. حسب الريجن اللي انت موجود بيه. Reported incidence may also be skewed يعني تتحرف depending on local referral pathways. Nasal fracture, for instance, are commonly treated by plastic surgeon and orthorhinologist as well as oral and maxillofacial surgeon. يعني مثلا كسور الأنف طبيب التجميل, طبيب ال ENT وأبو الماكسيلو كلهم يعالجوا. As a result, they may not be fully captured by any single database. يعني database مو كلها تقدر نسيطر عليها, لأنه الطبيب اللي يعالجها يختلف اختصاصه. There will also be a variation in the number of fracture treated by any particular specialist unit depending on geographical location, the demographics of the catchment population, and seasonal factors. Generally speaking, the most common facial fracture are nasal and mandibular fracture. أكثر بون يصير بفراكشر بالفيس من هو النيزل وراء المانديبل, followed by injuries to the zygoma, maxilla and orbit. أقل شي الأوربت, أكثر شي nose, mandible, zygoma, maxilla, orbit. Dentoalveolar fracture are also common but may not present to specialist centers. يعني المشكلة إنه ما تسجل بالداتا, so accurate figures are not widely available. Finally, the terminology used for recording injuries may add to the confusion about fracture incidence. For example, the term middle third fracture is not anatomically precise and may be used to include fracture of the midface, orbital, zygomatic complex, and fracture of the nose. In one large study of patients sustaining injuries as a result of personal assaults, approximately 80% of all fracture and 66% of all laceration were facial. شوف يعني هواية. Other prospective studies of several injury patients have shown that a significant number of maxillofacial injuries may also be associated with life-threatening injuries elsewhere. Of these patients, approximately one-fifth subsequently died while in hospital. This frequency of coexisting injury may have major application when considering transfer to special center. يعني هو يموت قبل لا يعالجوه جراحين الوجه. Causes of facial injuries, while at the same time there has been an increase in interpersonal violence and sports-related injuries. The incidence and causes of facial bone fracture are most influenced by geography المنطقة اللي تعايش بها social trends انت مكانتك الاجتماعية الكحول and drug abuse road traffic legislation و seasons حسب الموسم. Geography. Numerous studies have now shown clear relationship between urban living يعني المناطق الحضرية and facial injuries possibly linked to alcohol consumption and social deprivation. Not surprisingly, agriculture type injuries are more commonly seen in rural communication. يعني العنيفة يعني حسب يعني تصير بسبب الزراعة وين تكون مناطق النائية بالrural communities in developing countries where there is a rapid increase in road traffic. Motor vehicle related trauma is still a major cause of a fracture. من هي vehicle related trauma. In some countries, notably in some states in the USA, gunshot trauma now exceeds road traffic accidents as a cause of facial injuries. يعني عندهم إصابة الأسلحة النارية بالUSA أكثر من حوادث السيارات. Social trends. In more recent years in urban area, interpersonal violence has accounted for an increasing proportion of facial bone fracture. This includes domestic abuse. Data from a number of centers around the world suggests that interpersonal violence now accounts for more than half of all facial injuries seen in emergency departments حول العالم. In the UK, between 1977 and 1987, there was a 47% increase in maxillofacial injuries caused by assault يعني خلال 10 سنوات. While simultaneously there was a 24% decrease in road traffic accident victim with facial bone fracture لأن تطورت السيارات. The relative incidence of other facial injuries such as laceration has also been influenced by these trends. Alcohol and drug abuse. In many countries, alcohol and drug abuse are now major factors in the etiology of traumatic injuries. Maxillofacial injuries are commoner in young men than any other group, and to a large extent this is a reflection of the increased alcohol consumption by this section of society and the violence that they may ensue. يعني اليونج مان أكثر ناس يسعدهم إصابات في الوجه. Indeed, it has been said that the combination of alcohol and testosterone is a potent mix. يعني هو عنده تستيرون وشرب كحول استلم. Alcohol and drugs may also be a significant factor in maxillary facial injuries sustained by road users. يعني هو سكران وساق سيارة. The influence of alcohol on maxillofacial trauma was clearly demonstrated in a large prospective study of 61,114 facial injuries presenting over a period of 1 week to 163 UK emergencies department. يعني خلال أسبوع سجلوا 6114 إصابة بالوجه بسبب شنو؟ بسبب الكحول. وين بالUK. Of these 40% of facial injuries were caused by falls سقوط, a large proportion of which were in children under 5 years and occurred within the home داخل البيت. However, 24% of the injuries were caused by interpersonal violence بسبب العنف, mainly in young adults. In this group, alcohol consumption was implicated in some way in 55%. Only 5% of facial injuries were caused by road traffic accidents, يعني أكثر شيء بسبب الكحول. ثانيا عند الأطفال بسبب السقوط, وبعدها بسبب العنف, وأقل شيء بسبب ال RTA. Facial injuries were caused by road traffic accident RTA, with 15% of victims having consumed alcohol. يعني الصاحي 5%, بس اللي متعاطى كحول 15%. The 15 to 25 age group يعني من عمر المراهقة إلى بداية البلوغ, age group suffered the greatest number of facial injuries to either assault or RTA بسبب العنف أو الحوادث, and had the highest number of injuries associated with alcohol consumption. Overall, at least 22% of all facial injuries in all age groups were related to alcohol consumption within 4 hours of the injury. Road traffic legislation, يعني حسب القوانين. Vehicle safety design has been influenced both by research and legalization. And in many countries, the use of seatbelt restraint has now been made compulsory in law. Seatbelts have resulted in a dramatic decrease in injury overall and severe injury in particular, and that general trend has been reflected in the incidence of facial injury. The beneficial effects of improved car design and the use of seatbelts are now well accepted, although there is some evidence that seatbelts are not entirely effective in reducing the incidence of mandibular fracture. Airbags have also been associated with particular injuries pattern to the orbit and the globe. Interestingly, enforced low speed limits do not appear to carry the same benefits for facial fracture compared with other types of injury. Recently, as a result of these changes, many patients who would have otherwise died are now surviving. Helmets are also mandatory for cycling and motorcyclists alike in many countries, although most cycle helmets are primarily designed for brain protection and offer little effective protection to the face. Seasons. Facial fractures show a seasonal variation in most temperate zones, which reflects the increased traffic and increased urban violence during summer months and the adverse road condition in the presence of snow and ice in midwinter. Sporting injuries also show a marked seasonal variation. Seasonal affective disorders and failed attempts at suicide may make a very small contribution in some countries. Principle of treatment. Surgical anatomy. هسه شوفوا هنا سالفة الرود ترافيك شو يقول لك. many patients اللي كانوا على وشك الموت حاليا ينجون, بس هي شنو الفكرة؟ يقول لك seat belt. Although there is some evidence that seat belts are not entirely effective in reducing the incidence of mandibular fracture. يقول لك seat belt يحمي الشخص من الموت بس ما يحمي من mandibular fracture, where airbags has been associated with particular injury pattern to orbit and globe. الairbag ده سبب لنا مشاكل بالعين. Interestingly, enforced low speed limits do not appear to carry the same benefits for facial fracture compared with other types of injury. يعني يقول لك تخفيض السرعة limits do not appear, يعني ما غير لنا مشاكل بالوجه presently. يعني هسه anyways خلينا نكمل هنا. Principle of treatment. Surgical anatomy. The facial skeleton. Understanding the applied surgical anatomy of the facial. يعني applied anatomy كلش مهم حتى تكون جراح وجه. Facial skeleton and its associated structure is extremely important in the assessment management of facial fracture. Specific fracture patterns are well known to commonly occur and the effects of displaced bone fragments, notably at the skull base and orbital apex كان وين أكثر شي skull base والorbital apex can dramatically affect risk and outcomes. يعني أكثر شي skull base والorbital apex. Traditionally, the facial skeleton has been divided into an upper, middle, and lower third. upper, middle, و lower third يعني ثلاث أثلاث. The lower third is the mandible. The upper third is formed by the frontal bone, and the middle third is the region extended downward from the frontal bone to the level of upper teeth. If the patient is edentulous, the upper alveolus. However, this arbitrary division now has much less role to play in modern management. هذا التقسيم تعسفي. The terminology used can also sometimes be a little confusing. Fractures of the middle third of the face are often referred to as upper jaw fracture or fracture of the maxilla. However, in view of the fact that adjacent bones are almost invariably involved, these terms are not strictly accurate. مو دقيقة. It is perhaps better to use the term midfacial and fractures of the midface. From a functional point, بدل ما تقول middle face لازم تقول يعني يقول لك بدل ما تقول fracture of the maxilla لازم تقول لأنه مو بس المغزلة راح ينكسر راح تقول mid face و fracture of mid face. From a functional point of view, an interesting and teleological question is why do some animals have sinuses? ليش عندهم? A number of theories exist, but the answer is still unclear. One suggestion is that the skeleton of the midface has evolved into a protective crumple zone, functioning much like the chassis of a modern car. As such, it acts as a cushion, absorbing the energy of any cranial directed impaction coming from an anterior or anterolateral direction حتى تحمي السكال. The midface can be considered as a fragile matchbox علبة كبريت sitting below and in front of a hard shell containing the brain. In this respect, it differs markedly from the rigid projection of the mandible below. تختلف الميدفيس يكون كأنه علبة كبريت ضعيفة بينما المانديبل يكون rigid. The midfacial bones have the capacity to absorb impact energy, thereby protecting the brain and conferring a survival advantage. تزيد فرصتنا بالنجاة. Any impact directly applied to the cranium may be sufficient to cause severe brain injury. However, the same force applied to the midface is cushioned as the bones collapse. يعني بدل ما يصير لنا صعب البون نفس الهاية إذا أصابت الوجه راح تكون cushion. In many cases, the force is absorbed in such an extent that it may not even lead to loss of consciousness. أصلا ما يفقد الوعي. Of course, the price of surviving such an impact may be considerable damage to the bone, soft tissue of the face. مشكلتنا إنه راح يشوه وجهه. In those cases where the mandible absorbs the entire impact, the cushioning effect is reduced and brain injury can result. مشكلة المانديبل قلنا شنو؟ rigid. فيزيد فرصة brain injury can result as within a boxer's knockout punch. However, occasionally one or both condyles fracture following a blow to the chin. This mechanism may afford some degree of protection to the brain stem and upper cervical cord passing through the rigid foramen magnum. الكوندايل راح ينكسر. صحيح المانديبل القوي ما راح ينكسر، بس الكوندايل راح ينكسر. راح يحمينا الأبر cervical cord passing through the foramen magnum. The midface is therefore so ordered that it can simultaneously withstand the forces of mastication at the same time provide protection for vital structure, notably the brain and eye. شنو vital structure اللي يحملهن البرين والآي. This design has evolved as a result of Wolff's law. شنو هو قانون Wolff which states شنو ينص على that healthy bone will remodel in response to functional loads حسب اللود مال الوظيفي اللي عليه to which it is subjected. In the face, most of this loading is related to biting and chewing forces where bone is not needed. It is resorbed من ما نحتاجه شو راح يسوي؟ يسوي resorption. Thus the midface contains the minimal amount of bone required to provide support. And protecting of survival important organs including the eyes and upper respiratory olfactory tract. يقول لك هنا تصميم diagram representation of relative strength of the skull and facial bone. The matchbox يعني عود الثقاب like structure of the midface cushions the force of impaction. B. Whereas a blow to the skull is transmitted directly to the intracranial contents. A. An impact to the mandible. C. Is transmitted directly to the cranial base. Damage to the brain may be prevented by protecting fracture of the condylar neck. إذا وقع على المانديبل الكوندايل راح ينكسر, which is presented here as the handle of bent baseball bat. An automatic specimen showing the bones of the head and upper face separated and mounted to show their complex interrelations. يعني يقول لك مو عظم واحد راح يتكسر لأنه مرتبطات ببعض. هسه anyway, the bones of midface can therefore be thought of as a series of vertical and horizontal bony structure or buttresses. شنو معناها buttresses؟ باترسز ايه باترز ماخذيها هاي ماخذيها بالجراحة. a series of vertical horizontal bony struts. شنو معناها struts؟ اهو دعامات buttresses. الbutters surrounding the sinuses, eyes and uppermost part of the respiratory tract. يحملنا العيون والساينس والrespiratory tract. Joining these buttresses together is wafer thin bone. اللي يجمع ذن الباترز الدعامات يكون thin bone كأنه wafer. شوفي هاي نستله. The forces of mastication are those distributed around the nasal airway, globes and paranasal sinus as they pass upward. The force of mastication تتوزع النازل airway والglobes يعني محجر العين والparanasal sinus as they pass upward to the relatively rigid skull base. Experiments have supported this theory. قانون الbutters. Fractures of the midface have been shown to occur with forces between 1/5 and 1/3 of those required to produce simple fracture of the mandible. Although this crumple zone type arrangement may appear to have an obvious survival advantage, collapse of the butters can result in significant displacement of the tissue. مشكلة صحيح من حوض على حياتك بس يشوه وجهك. The mid-facial bone as a whole have a very low tolerance to impact forces. من الميدفيس the nasal bones are least resistant, followed by zygomatic arch, which while the maxilla أقل شي منه أضعف شي الناز، والنوع من هو zygomatic arch, while the maxilla itself is very sensitive to horizontal impacts. المازلة شنو مشكلتها وهي الهوريزونتال، بس بشكل عام كلهن عندهن low tolerance. The upper third of the facial skeleton is chiefly the frontal bone, which forms the superior orbital margin and orbital roof. From here, the base of the skull extends backward and downwards at approximately 45 degrees from the frontal bone. The midfacial complex articulates with this slope, and it is effectively suspended from the skull base. In the midline, the cribriform blade of the ethmoid makes contact with the meningitis with the meninges of the brain. منطقة الإثمويد وهي أغشية الدماغ the brain and transmit the olfactory nerve. High energy impacts the nail butters. The view of the anterior cranial base showing the cribriform blade of the ethmoid with the olfactory nerve foramina and facial midline crista galli. The cerebral bone is fractured in high midfacial Lefort type and serves severe naso-orbital ethmoid injuries. Damage the underlying dura may result in cerebrospinal fluid rhinorrhea. High energy impact can result in the middle third of face being shielded off the cranial base infosal with displacement downward. when ينزل لجوا and backward يدخل لتحت دائما displacement downward or backward along with this plane. As a result, the upper posterior teeth impact on the lower ones and probe open the bite. Clinically, this results in an elongated face and an interior open bite. In severe cases, there may be significant swelling and severe bleeding. Airway compromise may occur, particularly in the supine patient. شو يصير عندنا airway compromise. In most fracture of the facial skeleton, the frontal and sphenoid bones, including the greater and lesser wing, are not usually fractured. In fact, they are protected to a considerable extent by the cushioning effect achieved by the midfacial already mentioned. يعني راح ينكسر الميدفيس فإنما راح يجيهن قوة الصدمة، الميدفيس راح يمتص الصدمة. Fracture of the cranial components tend to occur following direct blows to these bones. يعني إلا تضربها بشكل مباشر يلا يصير بيها منطقة الكرانيوم. العفو. The protective butters also define the three-dimensional shape of the face. هنا يحددن الشكل مال الفيس ثلاثي الأبعاد. When it comes to planning the treatment of injured facial skeleton, attention to the butters is important. كلش مهم. Anatomical reduction is essential. لازم يعني تسوي الريدكشن حسب التشريح مالته مو كيفك. are essential in if a precise three-dimensional re-establishment of face high width and projection is to be achieved. that ترجع الويدث والهايت والبروجكشن مال الفيس لازم الريدكشن مالتك يكون anatomically. Attention to the nasal septum is also an important part of this and is often overlooked. مشكلة إنه ينسوه. Not only is the septum crucial in the development of a growing mid face يعني كلش مهم بالdevelopment but is an important element in maintaining nasal projection and patency. يحافظ على البيتنسي مال التنفس. وهم الشكل a useful way to visualize the facial skeleton is to think of it like a framed picture when viewed from in front. Useful way to visualize it. The frame is made up of the rigid frontal bone above, two vertical lateral structs made up by the lateral orbital margin and the zygomatic complex, and a lower horizontal mandibular platform which is hinged and mobile. This frame contains a complicated picture made up of the multiple bones of the midface. The orbital contains paranasal sinus and teeth. The orbital contains paranasal sinus and teeth. يقول لك هاي الفريم هنا بدنا نتذكرهن made up the multiple bones of the midface. البيكتشر عبارة عن multiple bones of the midface. Orbital contains paranasal sinus and teeth. The overlying soft tissue, the glass. هو احنا مو قلنا هذا فريم مال الصورة؟ هو من هو الجلاس مالت الصورة؟ الsoft tissue, including the cartilaginous nasal skeleton, complete the composition. This analogy is useful if a frame picture is damaged. It is repaired in a logical order. بالسرعة نمشي. The frame is further reconstructed followed by a detailed restoration of the contents and finally the protective glass is replaced. أول شي نعدل الفريم, بعدها الكونتنت, بعدها الجلاس. Although correct sequences is important when repairing complex facial injuries, the precise order is somewhat controversial, يعني مثير للدجال حسب الشخص, and on options differ, يختلف حسب. One possible sequence can be represented diaphragmally using concentric circle as a guide. هذا يعني من جوا لبرا, من الناس للخلف as a guide. هسه هذا شنو نقول لك؟ هذا the importance of accurate aortic reduction to restore all three dimensions of facial skeleton, presenting of a three-dimensional CT scan of complex facial fracture that has been reduced and treated with mini blade fixation of main buttress area, reproducing with kind permission of Springer Science and Business Media. معناه diaphragm to illustrate sequence of multiple facial fracture repair. The outer circle defines the frame. أول شي يبدون من outer surface, من outer circle حتى يرجعون الفريم of strangle bones that are reduced and embolized first. يعني بنبدي من البرة لجوا. Frontal bone, lateral orbital margin, zygoma and mandible. The middle circle contains the contents of the frame, essentially the maxilla, that are reduced and repaired next, and finally the nasal complex. Inner circle is resorted, يعني من برا لجوا. Soft tissue envelope. The healing process following a fracture can be considered under two aspects: healing to the soft tissues and healing of the bone. يعني healing process مال fracture لازم soft tissue و bone. Correct management of the associated soft tissue injury is essential and often underappreciated. كلش مهم. It is not just a case of getting the bones back together. The entire healing process and subsequent rehabilitation relies heavily on the viability of the soft tissue envelope, more specifically its blood supply. As such, it is important to be mindful that the energy force that resulted in the fracture also passes through the overlying soft tissues to get to the bone. يقول لك إنه يعني الفورس اللي سوت لنا الكسر فاتت بالsoft tissue على وصلت للبون. The soft tissue are therefore injured to a varying extent, quite apart from the additional trauma of any surgical repair. ويا surgical repair هم صارت فيها trauma. Blast, crush and compound injuries are obvious examples of soft tissue injury, and laceration do not necessarily need to be present to indicate extensive damage to the soft tissue. يعني مو شرط laceration موجودة حتى تكون ظاهرة obvious soft tissue. يقول لك laceration مو ضروري تكون موجودة حتى نقول إنه صار أكو damage للsoft tissue. With most blunt trauma, of course, soft tissue loss and gross contamination is unusual. أقول لك with most blunt trauma, of course, soft tissue loss and gross contamination is unusual. يعني لا صارت عندنا loss ولا gross contamination. Although the soft tissue may still be significantly damaged. In orthopedic surgery, جراحة التجميل, it is often thought that the success of fracture management depends not only on the condition of the bones and how well they are repaired, but also to a large extent on the condition of the overlying soft tissue. Consider, for example, two identical fractures, one of which is covered by healthy, well-vascularized soft tissue, while the other is exposed through a heavily contaminated open wound following a crush injury. Whether the fracture is in the leg, arm, mandible, or midface, intuitively outcomes will be better in the first fracture than the second. يعني بدون شك. This comparison highlights the importance of soft tissue, and in particular the blood supply, in the healing process. In this regard, the mechanism of injury gives useful clues as to the likelihood of injury to the soft tissues. Take, for example, fractures following a single punch, being kicked by a horse. شوف يقول لك in this regard, the mechanism of injury gives useful clues as to the likelihood of injury to the soft tissue. طريقة الإصابة. Take, for example, fractures following a single punch, ضربة واحدة, being kicked by a horse, a blast injury, and being shot. Each mechanism carries with it increasing amount of kinetic energy, potentially compromising the vascularization of the tissue. The more the blood supply is compromised, the greater the chances of infection, non-healing, and bone loss. Communication in a fracture implies high energy transfer, and more energy is therefore transferred to the surrounding soft tissue during the injury. Energy. Excessive movement across the fracture also has an adverse effect in healing by preventing vascularization of the bone fragments. These fractures have major implications for the choice of repair. Gunshot or missile injuries also transfer a considerable amount of energy and blast effects deep into the tissue. Ballistic injuries of this type differ from most other facial injuries. تختلف عن بقية. They are often heavily contaminated with extensive soft tissue disruption and tissue loss. They may also be associated with thermal injury, and the transmission of a blast effect through the tissue may result in damage at sites relatively remote from injury. يعني حتى الأماكن بعيدة عن الإصابة، لأنه هذا انفجار أو إصابة بطلق ناري راح تنصاب حتى الأماكن البعيدة. Contaminated wounds may therefore require several operations with serial debridement and backing. However, in the maxillofacial region, because of the excellent blood supply, this is only required in really heavily contaminated wounds. Management of this type of injury requires experience and judgment. If there is any doubt about tissue viability, it is better to adopt a watch and wait policy. Like if there is any doubt about this tissue viability, it is better to adopt watch and wait policy and delay intervention for 24 hours or so in order that non-vital tissue can declare itself. Fracture classification. The basic orthopedic classification of fracture as simple, open, simple, open, comminuted, and pathological can equally be applied to the facial skeleton. Comminuted bruised minute particle يعني مسحوق السحق فتت simple closed. These include fractures of condyle process closed يعني ما عندنا soft tissue injury يعني ما مفتوح للخارج ماكو communication ويا الانفايرمنت الخارجية. These include fracture of the condyle process, coronoid process and ramus of the mandible. بالmandible it's simple. And the fracture of the body of the edentulous mandible. The green stick fracture is a rare variant of simple fracture and is found exclusively in children. Open compound متصل. Fractures of the tooth-bearing portion of mandible and midface are nearly always open into the mouth via the periodontal membrane. More rarely, fracture may be compound through the overlying skin. Nasal and zygomatic fracture are technically open into the sinonasal airway tract, but usually heal without infective complication, probably due to their extensive blood supply. Comminuted المسحوق المفتت. A comminuted fracture is one where the bone is fragmented مجزأ إلى قطع into multiple pieces. This usually requires considerably more energy than does a simple fracture يعني الإصابة أشد. Direct violence to the mandible from penetrating sharp object as missile يعني بالانفجارات may cause limited or extensive comminution. Such fractures are usually compound. بالإصابات النارية والانفجارات شو تكون نوعها compound يعني comminuted بس هي تكون compound or and may be further complicated by bone and soft tissue loss. مشكلتهن إنه تتعقد الsoft tissue loss وحتى البون loss. Pathological النوع الرابع. Fracture are termed pathological when they result from minimal trauma to a bone already weakened by a pre-existing pathological condition such as osteomyelitis, neoplasm يعني أورام or generalized skeletal disease. In the face, this is most commonly seen in the mandible. شو يصير عندنا osteomyelitis بالmandible. Whilst this orthopedic classification is applicable to the facial skeleton, a more practical approach is to consider maxillofacial fracture as falling into one of two main groups. لأني هسه حكينا الحين مال جماعة التجميل. هسه احنا كمان زين لو شو نستعمل fracture without gross communication of the bone and without significant loss of hard or soft tissue. Fracture with the gross comminution of the bone and with extensive loss of both hard and soft tissue. هاي احنا نستعملها بالماكسيلا. The majority of fractures fall into the first category. ماكو عندنا gross. Those in the second group either result from missile injuries بالحروب, industrial injuries involving machinery, or major road accidents where there is direct injury from sharp objects moving at relatively high velocity. يعني تصير بالحروب بالمصانع وبالطرق. من هي النوع الثاني اللي يكون gross although somewhat arbitrary يعني مثير للدجل أعتقد يعني مو صدق حقيقي، يعني مو صدق دقيق. This broad division is useful because يعني هو هذا صحيح يكون arbitrary هذا التصنيف اللي عبارة عن نوعين. This broad division is useful because the management of the second group is entirely different from the first, both in terms of the primary assessment and repair. Fracture healing. Fracture healing is often referred to as direct or indirect. These are two entirely different processes and have major application in management. Direct healing or primary bone healing can only occur when there is absolute rigidity across a fracture and sufficient bone to bone contact. هذا شنو؟ direct healing when يكون rigid or contact. Growth of bone occurs across the gap and there is no callus formation. Compression across a fracture is believed to facilitate this, and healing is usually rapid, although plating techniques in orthopedic surgery are designed to الأورثوبيديك يعني جراحة عظام، جراحة عظام وجراحة تجميل. Oh my god، اسمها بلاستيك. although plating techniques in orthopedic surgery are designed to encourage direct healing in the face, this is only practically possible in the mandible. يعني الطرق مع جراحين العظام تنطبق فقط بالmandible. This is because direct healing requires heavy plating and large screws to achieve the necessary degree of rigidity and compression. Indirect healing is a different process and occurs across fracture where some degree of mobility persists. This is seen in limbs treated with orthopedic casts and is the natural healing process seen in land mammals, الحيوانات اللبنية. Initial hematoma formation is followed by the ingrowth of delicate fibrovascular tissue. Gradual ossification then occurs. Hematoma والنوب fibrovascular والنوب ossification, and the fracture is encased by immature bone or callus. نفس الامmature bone اسمه callus. This is more prominent in load-bearing situation and provides early stability. This is more prominent in load-bearing situation and provide early stability. Once fully healed, remodeling of the callus occurs, resulting in the final trabecular or mature bone. Callus formation therefore implies some degree of mobility across a fracture during healing. This type of healing is more commonly seen following rapid of facial fracture. This type of healing is more commonly seen following repair of facial fractures. Although with the newer materials, fixation hardware is achieving increasingly greater degree of rigidity. ويتطور. Principles of fracture repair. In both orthopedic surgery and maxillofacial surgery, there are a number of basic principles commonly shared in fracture management. Both specialties سواء بالماكسيلو أو الأورثوبيديك. Both specialties have now moved toward open repair of most fracture. نسوي عملية ونتصلح. In preference to less precise method of close reduction, open repair facilitates anatomical reduction and fixation and subsequent restoration of function. The relationship between excessive movement, poor union, and infection is also well understood in both specialties. However, unlike limb fracture, the repair of maxillofacial surgery injuries can generally wait longer if necessary. عادي ننتظر. This is due to the presence of the excellent blood supply to the face and where relevant salivary growth factors Facial fracture can also be more extensively exposed with less risk of infection or necrosis. Complete detachment of bone from the soft tissue, extracorporeal repair, and non-vascularized bone grafting are also possible. يقول لك detachment of bone from the soft tissue extracorporeal يعني تطلع البون وتصلحه ونبرجعه عادي. And non-vascularized bone grafting are also possible. However, the repair of facial fracture require a higher level of precision than most orthopedic injury in order to achieve optimal function and aesthetic. يعني لازم أدق من جراحة العظام. Fracture fixation may be either rigid or semi-rigid. In the strictest sense, rigid fixation means that there will be no movement whatsoever across the fracture site. This procedure produces such a level of stability that direct bone healing can take place. Assuming there is sufficient bone-to-bone contact, rigid fixation therefore requires strong load-bearing fixation devices, usually large blades and bicortical screws. As such, these devices tend to be bulky and can only be used in the mandible. اوكي يعني هذا النوع اللي يستعمله جراحين العظام نقدر نستعمله بس في الماندبل. The other اللي هو الريجيد نستعمله بالماندبل. The other bones on the face are too friable to support such blades. With semi-rigid fixation there is still adequate support, although a variable amount of micro movement will still occur. Much smaller so-called mini blades can therefore be used. Currently, opinions differ on the amount of stability that is required for optimal healing. Rigid fixation is not as critical in the face as it is in the limbs, and therefore maxillofacial fracture can be managed in several ways. Intermaxillary fixation, semi-rigid fixation, and rigid fixation can all result in satisfactory healing, yet the degree of stability that each procedure clearly varies. Further reading ما علينا بيها.